Let's begin here at this hour. As South Africa marks Child Protection Week, concerns are mounting about the safety of children. Children are having children, others are being neglected, raped and even murdered. There are calls for resources also to be increased towards ensuring that the safety of children is properly addressed every day. Let's have a conversation now that looks at Gauteng with the Gauteng Social Development MEC, Morakane Mosupyoe, alongside anti-drug activist and Yellow Ribbon Foundation founder Dereleen. James, thank you so much to you both this evening. I'll begin with you, Dereleen. Child Protection Week is not just about, the ensuring the safety of children, but this is important to do it on a daily basis. Yet at community level, it looks like this is not always the case. Talk to us about your experience on the ground.
Ongi, good evening, and thank you so much for having me. I'm just off the phone with one of our community activists, Cheryl Pillay, before I joined the interview, and unfortunately I couldn't join them on the ground today. And I asked her, what do things look like in our community today? And she said to me, Dee, over the past week we have covered a total of 180 homes, and of the 180 homes, more than 50% of those houses are referrals for cases. She was telling me it is just chaotic, where you find that children are on substance as young as 8. Children have absconded from school. We have visited some of these schools, and the principals have told us that these children hasn't been in school for more than 40 days, where both parents are on substance. In cases where these kids are living with their grands, you find that their SASSA cards is either with the machonisa or the mother has the SASSA card of the child. The situation on the ground is just dire, and unfortunately, we don't see services being rendered, for the cases where, like day before yesterday, we had a case where a 3-year-old girl was being sexually molested by her mum. We then called child welfare. We were then told by child welfare that in the south of Johannesburg, they only have 6 social workers, each with a caseload of 300 and above, and 3 of them are off sick, 1 is on leave, 2 of them is at court. So where does that leave the community of Eldorado Park?
And
we've actually just decided.
I'm going to ask you just to pause for a second, because that's where I want to go to next when it comes to the issue of resources. And I see the MEC as well shaking her head as she listens to some of the horrific cases that you are describing. MEC, last year, for example, the Democratic Alliance in Gauteng raised concern about the shortage of critical skills in, the department that you head up, and they say these include social workers, psychologists, among others. Listening to Dereleen, this situation does not appear to have improved.
No, thank you very much for the invitation, and good evening to both of you and to your viewers. You're correct. I was shaking my head while she was speaking, because it paints a very dire picture of what is happening on the ground on our children. I want to respond directly first to the question that you asked regarding the shortage of social workers. The database that we have as social development in Gauteng gives us a number of over 2,000 to 3,000 social workers that we have. And those are social workers that are either paid directly by the department or they work through the NGOs that we have. I do agree that the shortage exists, and that I'm not even going to argue with. But the problem that we face as the department is that we would provide bursaries for social workers. Some just apply directly to the department and we give them work. Unfortunately, private sector pays better than we do, and they leave. We are trying to attract as many as we can. As you know, during COVID, sometime earlier last year, the minister did provide some funding for us as Gauteng to get more social workers on board. Unfortunately, the money arrived late, so we had to take it back to National for us to re-look at the contract that we have with National Department, so that those social workers can be employed over a period of more than a year. It didn't make sense to us that we should keep them for 1 year. We need them beyond that. So discussions are still ongoing between us and National, and we are hoping that the minister actually assured us that the money will be provided. So it's just for us care of systemic problems, and then we'll get them back.
MEC, pardon me for coming in there. What does it mean then at a practical level? Because if discussions are still happening behind closed doors, a child is being molested, a child is being neglected, a SASSA card of a child is being taken by a parent who goes and drinks alcohol, and this happens while discussions are happening behind closed doors.
Yeah, I think I need to put that into better context. I didn't say we're not providing services. We still are providing services. Let me start with something that bothers me as well, and I think the minister also spoke to this. Parents also have responsibility. So if a family, the mother or the father or even the grandchild, the grandparent, we normally don't have lots of problems with grandparents. If they are given a grant, they also have a responsibility to make sure that that money goes to where it's supposed to be, taking care of the family. But you are raising a question that we know that it exists. If that happens, then we have to come in as social development, and we can do one of three things or all three. The first thing would be to remove the child from that environment because it's not conducive for a child. So we refer them to our CYCC, Child and Youth Care Centers, but that has to go through a court system. And the second thing that we can do, and which we do, is to give them psychosocial support, to remove the parent as well, take the parent for rehabilitation if they agree. They're adults, remember? And in law, we cannot force them. And if we have to force, there is a legal process that has to unfold. And then the third thing that we do is to give them support where they are, but the child must be removed. Remember, we are custodians of the Children's Act. So we are yes, to take care of the children, and that links actually to the week that we're in. But I wanted to respond.
Thank you very much, MEC, for that. Dereleen, you're listening to that, and there's talk of, ideally, if you listen to the MEC, if these were put in place now, you know, a lot could be done to assist, but this shortage is having a serious impact on the ground, as you've just briefly alluded to us as well.
Yes. Yes, and I think the reason why I'm mentioning, because obviously bringing it to the attention of the MEC, she doesn't live in Eldorado Park, so we can look at ways of better serving our communities. And the situation, I just want to also say that the situation in Eldorado Park is not only in our community, it is a synopsis of communities across Gauteng. And you also look at MEC, sometimes, you know what, thank you, we do get social workers in our area at times, we do have them there, but some of them aren't capacitated with the Act, and they don't know how to apply the policy in dealing with certain cases. In Eldorado Park, we've actually had, some years ago, there was a lady in the department, Daphne Naidu, who was servicing our community, who was capacitating us on the Act, you know, and ensuring that there's an holistic approach, an approach that actually speaks to parents being capacitated. I mean, we don't want to be removing kids from families. That is the last thing we want to do. We want to do a holistic approach with the family, with the children, with the go-go, everyone in place. And for us, in order for us to do that, we need to be capacitated with legislative, with the policy. And in order for us to do that, we need people that can come out and empower our community. And now, sort of, when we call into the department and we ask for this one person to come out and assist us, we told that she's been moved, you know, and she cannot come out. So now, that is the one challenge.
Dereleen,
the other challenge
allow me for coming in there. I don't want you to lose this point. You talk about a holistic approach, you know, to assist these families. What does it look like for a mother who chooses to go to a lolly lounge with the SASSA grant money that is supposed to be for the child, and they then, you know, are on drugs and they spend time there for reasons known to them? How do you begin as healthcare workers or even care workers with your foundation to assist this family holistically?
It is not just my foundation. Like I said, in Eldorado Park, we work as a team. So if each one has a role to play. In terms of the children, we will then have to get, if the child is below the age of 12, unfortunately or fortunately, we have to call on child welfare services to do a psychosocial assessment of the home and of the child. We also need to get the mum to commit to rehabilitation, which is very difficult at most times. Sometimes we found that the granny is being abused. We need to call the municipality that can assign a social worker that is familiar with the Older Persons Act. Unemployment plays a great part in this as well. We go into some of the homes where you find 3 or 4 kids sleeping on a mattress with a male, and there's no privacy, there's no ablution facilities. But you know what, there's just so much to talking points to speak to tonight, and I don't think that this interview will do us justice. But what we do need is to sit together and look at how best we can extend resources or pilot in Eldorado Park that we can roll out to the rest of Gauteng in terms of capacitating all social workers, and also look at getting more CPOs involved in terms of rendering services, because like I've just mentioned, the one CPO cannot cope with the caseload.
MEC, you wanted to come in?
Yeah, I just want to respond to that. What I like about what she said is that it brings to all of our attention that this is a multi-sectoral problem, and it needs a multi-sectoral approach. I agree with you fully, Dee. And I'm actually encouraged listening to you that you actually have an idea, and I don't know how long you've been doing this work, but it gives me courage that we will be able to work with you. So basically what we do as a department, we work with NGOs, NPOs, and HDIs, as you know, I'm sure you're already. So yes. I would like to, after the interview, get your number so that we can take what you were proposing now forward, because it's part of what we have planned for this new financial year. And this, why we had to tweak our program, it's because of the workload that was brought along by the pandemic that we just came from. So it's, it increased our workload towards children. And you're correct, poverty plays a role in this, but it does not mean us as a department then we can, just leave that as an excuse. We have to act. Hence, I'm saying that, I'm excited by what you're saying, that we can link with yourselves and organizations, other organizations in your area, and work with you. Unfortunately, I don't have the statistics of how many NGOs we have in your area, but that I can get. And then we will link up with them and see exactly what is it that we can do. It's not going to be a pilot, it must be a continuous program, because protecting children, it's not a once-off action. It must be continuous. So whatever it is that we'll be doing with you, it must be a program that we are able to run over a period of time where, yes, we will be, taking notes and making observations of where are the gaps. But the program itself must continue beyond
all right.
What we're doing together. Yeah, it must continue.
Unfortunately, we're out of time, MEC, but I'm very encouraged by the fact that, as Dereleen was saying, that this interview does not even begin to scratch the surface, but I'm encouraged by the fact that now both of you are going to speak, and you're going to now start with these programs, because it is time. So thank you so much for this commitment from both of you. Certainly do appreciate it, and we'll continue to track through you, Dereleen, and the MEC in order to see how things are going to be able to assist the children. Thank you so much for that. That is the Gauteng Social Development MEC. Mama Morakane Mosupyoe, also alongside anti-drug activist and Yellow Ribbon Foundation founder Dereleen James.